I'm going to ask you for 3 pearls of wisdom that you'd like to share with a dry eye colleague running a busy clinic and managing some dry eye patients. What 3 gems can you give them to take home and use?
Okay, I think the first gem would be that even if you see signs or there are symptoms of things that suggest that meibomian gland dysfunction isn't the major problem, if you do see any meibomian gland dysfunction, you must target it in your treatment. So I think it's relatively underdiagnosed. People often see some staphylococcal collarettes around the lashes, or they may see signs of Demodex, and they tend to overlook meibomian gland dysfunction. But whatever else is going on, because often various forms of ocular surface disease will coexist with each other, targeting meibomian gland dysfunction in every single one of them is absolutely key. So I think that would be my first point. My second point would be the understanding for both the practitioner and the patient that getting symptoms under control is not something that can happen quickly. So you cannot just instigate one treatment and expect there to be a difference in a week or two. It takes, for most interventions, whatever you're doing, whether it's conservative or therapeutic in terms of drugs, topical or systemic, it takes 6 weeks for them to start working and 3 months for maximum effect. To really change the ocular surface takes a long time. So that's another really key point. And the third is compliance. You really have to work with your patients so that you trust each other, so that they will feel comfortable to say to you, you know what, I can't do hot compresses 3 times a week. I can't do it every day, or I'm just not doing it. So you actually know what they are doing and what they're capable of. And you can then look at alternatives if they're just not going to comply with the treatment you've otherwise recommended. Those, I think, would be my three main nuggets.
What was your biggest lesson, or should I say scariest moment that you've had in managing dry eye disease? What do you consider to be the greatest tool for either diagnosis of dry eye disease or possibly an interventional medicine for the treatment of dry eye disease?